A lot of people do find relief, sometimes in the first, second therapy that they try, but that's not what happened for me. I had an aggressive onset, and within 3 months, I saw a GI specialist. A week later, I had a colonoscopy, and that day I was diagnosed with pan-ulcerative colitis, which means ulcers throughout the entire colon. Once I was diagnosed, I was started on two less aggressive pill therapies, which both failed. I had no symptomatic relief from them.
Sometimes we'll use steroids, and that will help get it under control, often very rapidly, but it has a lot of long-term side effects.
While they save your life, because they do, they suppress your immune system. They have so many side effects with them that are just grueling. You get like fat deposit in your face, and people who I knew didn't recognize me anymore if I hadn't seen them for a period of time, and that was very upsetting. I started to move on to biologics, infusion, drugs, a few other pill drugs. I basically tried every single drug on the market within that year I took off from school, and none of them worked.
Sometimes we say, the best thing to do is just to take the colon out completely and be done with all of this.
So basically, when I sat down with the doctor in the emergency room, they explained to me that since I had run through every treatment on the market, the steroids that were supposed to be my saving grace were no longer working, and that I didn't have an infection. I could either try clinical trials, or I could have an elective total colectomy, or a total removal of my colon, and then I would get an ileostomy, which is something I had heard of.
When Chelsea first came to see me, she had severe ulcerative colitis, which was deeply affecting her quality of life. She required multiple medical treatments, which unfortunately did not work well enough. And after a very extensive discussion with her, we took decision to proceed with an operation.
But when I was actually faced with that decision, it was really big and it was really scary. I had never had surgery before, and especially something as crazy as someone to tell you, we can just take out your entire large bowel, is wild.